Rev-Up Slu, the alpha of radio.
Doctor in the House is next with the compliments of La Place Salison, Ultramat, the Labrie Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapia Hospital, where the patient safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time, a time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
La Place Salison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salison, of course. La Place Salison, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, hosted by Dr. Leonard Suraj. Dr. Suraj, a very good evening to you.
Good evening, Andre. Good evening, listeners. Good evening, followers on the various platform modalities. And we are here today again, Tuesday, as usual, Doctor in the House. And I have with me, in fact, doctors in the house. I have with me, not a newcomer to this program, Dr. Charles Greenwich. He is a general surgeon as well as a vascular surgeon and have been in St. Lucia for quite a while. And so today, both of us have a fair amount of experience in the medical profession and certainly in the surgical profession. And we'll be talking about how we can make the practice of medicine and quality of healthcare better. What are the things that we feel that can make it better? And there is always room for improvement. No matter what you do, the day you stop improving is the day you have died. Your spirit has gone. So, Dr. Greenwich, welcome to the program, and I know I thrust that on you very late and ask you to formulate your ideas, but I know you're a man who can think on your foot.
Well, thank you very much, Leonard. Andre, it's always great to be at this program.
Great to have you.
Those who know me well know that Dr. Leonard Suraj is someone who I respect highly. I was very lucky many years ago to be vice president of the St. Lucia Medical and Dental Association when Dr. Suraj was the president. And it is then that I understood what a man can, when I say man, I mean generic, a man, a woman, a single person can make through their ability to think. Leonard is an extremely forward-thinking individual. While most of us are thinking about today, he's already thinking about 5, even 10 years down the road. And I think that it's very important that we look to Leonard and people like Leonard and start looking forward. A lot of us have the ability to think within our present realm. And of course, this is important. Things need done now, today. But I think that we probably do lack forward thinking. You know, don't think about a job that needs to be done today. Think about a situation where that job doesn't need done, or maybe that job is being done automatically. We probably do need to dedicate more time to future solutions, especially in this very dynamic world where we're not sure about the support that we are going to get from the areas that used to support us. And this is not only technologically but financially. So I think we do need to think about doing for ourselves in the future. And I'm very glad that Leonard has brought this point up today, so that we can actually discuss in the health realm how do St. Lucians come together to set up platforms that allow us to have better health for our people.
Absolutely. Yeah, that is well put, Dr. Greenidge. For example, I'll give you an example. I've been here for about 30 plus years, came in 91. And nobody has ever asked me, Doc, I want to build an ENT service so that many of our people will not have to go overseas for treatment. I want to build it to give our people much more larger quality of ENT medical care. I also want to see how we can diagnose children with heroin disease early o'clock, so we can direct them to mainstream education rather than sign language. Nobody has ever asked you that, and this is what you expect the policy makers to come to look at, to bring to the technical people and tell them, look, I want my service to go from point A to point B. You're the expert in there. Tell me how we can do it. Usually, the doctor would come in, specialize in one field or the other, carve out his niche. His standards have been set by his training ground. He collaborates with his colleagues, and to various extent, some more than others, and he develops a service and he practices. Most time, every piece of equipment that he possesses, he has to fork it out of his pocket to be able to produce that. And therefore, to say you're going to build a national service on that, there is a missing link. And so the person the specialist may be able to do most things, but he's handicapped by the lack of support, the lack of technological support, the lack of many other things. For example, most of us who would have gone at least once a year or once every 2 years, go out overseas to get trained. And when you get trained and get a refresher course, or you may do something that is outside of your regular training. Say, like for example, he did vascular surgery. Vascular surgery does not come as a major topic in your general study. It's something over and above what we call professional development. You have to do that. But this is very, there's only very small compensation for that, except that you learn how to do a few more surgical procedures. But there is no master plan that will encourage these kind of things so that we can develop. Among ourselves, our colleagues, if you have a unit where you meet often and you discuss things, we will grow that way, but there is no mechanism or systemic mechanism to assist us in growing and to offer a higher quality service to the general public. I don't know if I if this is making sense, but I remember when my professor he told me when he was looking for a job, he went for an interview in Cambridge, and it seemed as though they were not looking for a highly specialized person. They were looking for somebody who can take care of emergencies, and all the big cases go to another hospital. So he told them, but sir, you all don't need a specialist like me, you all need a registrar. And so they looked very, very condescending at him, and he never got the job. So he went to the other hospital where I met him, and he said, Doc, in the interview, they told me that we want to develop an ENT center that is as good as any other centers. We are just starting off. How do you think we can achieve that? And give me a path, and give me a budget, and let us see how we can work on it. And that's the kind of thing we should be looking towards. By now, we should have a 10, 15-year strat plan to know where we are going in that 15 years, so that, because you would not know it, but very recently, I have patients who have serious mastoid issues that require highly skilled surgery. And they have to find a way to train, and have to call the doctor, and have to pay their money up front, and have to organize place to stay. To me, we need to do better than that. And so that is why I thought, let us talk about this topic. Let's know how we can make the health service, our service better, the quality of service we offer people. Because it's not only the doctor, it is the support system that has, for example, I have done surgery where I removed the entire larynx, laryngectomy. But the patient would cannot speak through the voice because they don't have a voice box anymore. But they manage with sign language and a few other esophageal type of speech. But you are very reticent about doing that surgery because we don't have a speech therapist to assist them. And so you can see many things we can do are not being done because the support structure is not there to facilitate that. And so most time you don't do laryngectomies. So I think essentially the services, we have to look at a more holistic approach to the service that we offer. I don't know if you can have any particular example of how, for example, we need biomedical engineers, because sometimes our equipment do not last the presumed longevity of it, because it needs servicing, it's poly-service, so a lot of money is poured down the drain because you don't have the servicing necessary. Biomedical engineers are hard to come by, and they are extremely very talented people. And so I think that if you have equipment, you have to have a servicing mechanism, servicing contract. Otherwise, your expensive equipment can last only a small fraction of the duration it's supposed to last. And also issues like accreditation and calibration of equipment. According to the laws of the practice of hearing evaluation and testing, your equipment that you use to establish hearing must be calibrated every year to make sure that when you say 40 decibels, it is giving you 40. It has a lot of legal implication, because you can give me a blow on my face, on my head, damage my ear, and I told you I cannot hear. And but the real test is not what you say, but what the machine is reading when you do the audiogram. And that's what the lawyers will look for to establish hearing loss. Now, if your equipment is flawed, then that's a perfect way of dismissing your evidence. So I think that in terms of hearing evaluation, we have a long way to go as well. But I think that generally speaking, we we can offer much higher quality service if we have more partners, more equipment, and better servicing of the equipment. And even the companies will even come and teach you how to use it, because many a time equipment they don't function because they are used badly. Sometimes the instrumentation can be poorly handled, the equipment, and can damage the equipment. I don't know if you've ever seen any in your practice, you've seen any areas where you feel can be improved in the health service.
So, Leonard, I think you go in the wrong place with me now, because you know when you get a sore and you start to scratch it. I think that I think individual doctors and medical personnel in St. Lucia are all striving to improve service, but I don't want to negate any individual effort, but I think that the kind of effort that's required cannot be affected by one person.
Mm-hmm.
You need to have a much more holistic, systemic solution. You were talking about medical equipment, for example.
Mm-hmm.
I remember on more than one occasion being hustled to a meeting, both in the private and the public sector, because some company wants to meet and talk about something, some piece of equipment or something.
Yeah.
And well, I have to be very respectful on Andre's show, so I won't use the language that really comes to my core. But it's like, guys, hold on. We have to start determining what we want.
Mm-hmm.
And what we want will then determine who we ask to come and look at medical equipment.
Mm-hmm.
You know, I'm not interested in some new CT scan or some new MRI and you come and you... No. I want to be able to say, based on our plan, we need to have a new CT scan.
Mm-hmm.
And then we decide to approach the different companies and so forth. But I think there is not enough introspection and of course this now comes with data.
Yes, sir.
Because how do you know, how do we know that Leonard's problem of hearing is a national problem? He says, oh, but
Yes.
Andre, I don't know, you don't know. There might be another problem, for example, diabetic foot infection. Diabetic foot infection might be a problem that affects far more people, right?
Mhm.
So Leonard is jumping up and down. You're the minister or the PS. Leonard is jumping up and down, telling you, oh, you must get a new audiometry
Equipment,
center,
yeah.
blah, blah, blah. Me, I struggling working every day, so I don't even have time to tell you about the problems like, let's say, diabetic foot infection. And next thing I know, the government of St. Lucia or the private sector embarks on a huge project to improve audiometry services and all, you know, like wow and hey and
Picking up children early.
and it only affects 10 people a year.
Mm.
And then you have this other problem that's affecting hundreds a year. So we can't work like that. We have to set up a platform where we know what our problems are.
And prioritize
Right?
it.
So when Leonard, who is passionate, he's an ENT surgeon,
Yeah.
he's passionate about this. When he comes to the commission or whatever, and he says, look, guys, we need to do something about hearing, the commission will be able to say, Leonard, this is an important problem, but it is small in comparison to the issue we have with diabetic foot infection. We have to focus, we have to invest in services which allow us to deal with that problem, you know? So I think that our our decisions have to be based on data. And I know that, for example, right now, as far as I know, the Ministry of Health is embarking on a data collection system. But this is key so that we know we know what is in front of us. You know, it's like listening to the news. When you listen to the news, you know all about what you are told. You don't know about what you are not told. And so we can't operate on a system like that. We have to be able to have a platform that allows us to know exactly what the issues are concerning healthcare in St. Lucia. Is it a hospital solution or is it a community solution? You know, because I mean, we know, for example, Cuba has championed public health for many years, showing that if you spend your resources at the primary care level, then the need to spend at the tertiary care level is much reduced. I mean, that makes sense. If you have a diabetic who is well controlled, well, he won't get foot infection and he won't come into the hospital. So to solve the foot problem, should you get more surgeons to deal with the foot infection, or should you get more diabetic nurses, for example, you know? So I think that this is an area that we must move on.
Okay. Also, I think that parallel to what you just said is the need for education. Now, it is not that education is not made available to the patient. Somehow, the information that they have does not translate to a change in habit.
Mm-hmm.
So because from the time I entered, I came to St. Lucia, I was back here as early as 1984, when I was just a medical practitioner. I took my TV and video. I used to have video during that time. All in the countryside in Vieux-Fort, in Grace, these places, Labrie, doing lectures on teenage pregnancy, on various topics, diabetes, hypertension. And I know the Ministry of Health has done a lot of work in educating people. But somehow the complications or the disease process we see out of this condition are not abating. They still get a lot of cataracts, a lot of kidney failure. Don't talk about kidney failure and the dialysis. That's another area of concern. And the complication of diabetes has continued to be rampant. Statistically, I don't know if it's getting better, but all I know is that it is still very much a problem, despite all that education we are pumping in. So where is the missing link? Because we still have the problems. I don't know if competing information, false information, misinformation, disinformation, all these play a role in so that the patient would listen to you. By the time they go outside, somebody else tell them something that is different, and usually it's anecdotal. Oh, my uncle had this and he did that to cure it, and then everything went away. So this anecdotal kind of thing. So we have to make some changes, and what I propose is for us to begin to entertain behavioral modification as an element in our teaching tool when we begin to disseminate information to how behavior can change things. And in England, I know that the Ministry of Health has a section on behavioral modification, how you can change behavior.
Well, we'll take a little break now, Dr. Suraj and
All
Dr.
right.
Greenwich, and come back in just a moment just to remind our listeners and our viewers that this is Doctor in the House Live with Dr. Leonard Suraj, special guest Dr. Greenwich, brought you the compliments of La Place Salazon, Ultramart, the Labrie Cooperative Credit Union, and Tapia Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201 Tapio Hospital, where the patient's safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufriere.
It's delicious.
Welcome back to Doctor in the House live on Rev-Up Slu with Dr. Leonard Suraj. Dr. Suraj, is back to you.
Thank you again, Andre, and thanks listeners for staying on and listening to us. I have with me Dr. Greenidge, General Surgeon, with a special training and experience in vascular surgery of the vessels, arteries and veins, etc. We were talking about how we can improve quality of health service, and we were just basically a roundtable discussion. And even while the ads were going on, we were talking about how can we effect changes in terms of better habits so that your medical problems can be reduced, or you can take care of some of the illnesses that you have. Now, if you want to make a contribution or you want to join the discussion, you can call us at 572-9710, that's the fixed line, or WhatsApp at 287-0971. We're looking forward to hearing from you. And in the meantime, we'll just chat away. Yes, I agree that we have not been able to translate the information into change of habit. And I think these are the things we must monitor, how effective our public programs are. How do we measure whether we're doing good or not? Because we can spend tons of money in billboards, this, that, only to find out that it has not made a difference. But it seems as though if a donor agent gives you a certain amount of money to run a program, as far as you're concerned, you run the program. But how effective is it?
I think, again, this comes back to the question of data.
Mm-hmm.
You know, I think we have to measure what we're doing. As you said, you know, somebody puts on a big program or builds a big center, and we are congratulated for activity, but what effect, what change have you actually been able to effect?
Mm-hmm.
And I think, again, more time needs to be spent on this, in the sense that, for example, okay, how do you actually convince, let's say, a smoker to stop smoking? You know, when you look at, so it's okay, you have a problem, people are smoking, getting emphysema lung cancer. Or let us bring it really relevant.
Mm-hmm.
Smoking marijuana.
Right.
Okay? Anecdotal,
Mm-hmm.
I accept this. Today I saw a young patient
Mm-hmm.
at OKU on my ward round who has a collapsed lung. Young.
Okay.
Okay? I won't mention the
etc.
age. Young.
Mm-hmm.
Okay?
And
Now-
a collapsed lung is what?
Collapsed lung. So this is okay. So there's a condition called emphysema.
Mm-hmm.
Most people know emphysema as a condition that affects older persons who have been smoking real cigarettes for
No,
real years.
No, hold on to that, because I think there's a patois name for it. He may not know, because I don't think
Well,
he's...
educate me.
L'opposition. What's l'opposition?
I've never heard that one before.
Never heard of that?
L'opposition.
L'opposition.
L'opposition is a kind of shortness of breath.
Right,
Yeah. But you don't have any infection.
right.
You just shortness
So that's
of breath.
COPD.
That's COPD,
Right,
yeah.
okay. So we have this condition called l'opposition,
Mm-hmm.
okay? Otherwise known as emphysema. But
Emphysema.
basically what happens, if you think of bubbles, now the lung consists of many tiny bubbles.
Mm-hmm.
But what happens when you smoke for a long tobacco now, when you smoke tobacco for a long time, these little bubbles get absorbed into bigger bubbles. And as the bubbles become bigger and bigger and bigger, the lung becomes less and less effective. So it becomes big but no use. So you end up with a condition where the lung cannot function as it should, and you become short of breath.
Right.
That's the main symptom. You become short of
Because
breath.
the oxygen
Right?
is not exchanging.
Yeah, you can't. You cannot get the
Mhm.
oxygen in and the carbon dioxide out
yeah.
as you would, right? So the lung is failing. Basically, if you think of heart failure, this is lung failure, right?
Mm.
But this is a condition that traditionally, I mean, we've been seeing this for years, and fortunately, we don't tend to see it as much in St. Lucia because smoking is not as common and as frequent as you would see, for example, where Leonard and I trained in Scotland.
Mhm.
Now, in Scotland, for example, we would have seen patients 60 years old who have been smoking 40 to 80 cigarettes every day from the age of 10. Seriously,
Wow.
right? And when you see them, it's a sad thing to see because they look ill, they're wizened,
Mm.
they cannot breathe properly. A lot of them need oxygen supplementing, right? But I saw a young man today who fit that picture.
Same condition.
Same condition. And one of our doctors, Lisa Charles, had done a very important study showing that tobacco and marijuana together produces a very accelerated form of l'opposition, right? However, when I spoke to this young man, he told me that he doesn't smoke tobacco at all. He only smokes marijuana,
Okay.
right? And in my mind, and I think, again, I would hope that this would be backed up by medical evidence, there is a lot of harm that is being done by marijuana. However, marijuana is presented, I know I'm going to put myself in a lot of trouble, but it's okay. Marijuana actually can be very harmful. Now, you will always find a man who's smoking 80 cigarettes a day and he lived to 100. Of
Yeah.
course you will, right? But we're not interested in individual health. We're interested in public health, right? And I don't think, put it this way, if you were a surgeon working at OKU, your view of marijuana would be completely different to the young fella walking the street. okay, it causes a lot of harm. But where's our data? Where's our data? That's Dr. Greenwich talking. But where's our data?
By data, he means
Okay.
where's the information? Yeah.
Where are the facts that I can say to you? If a thousand young men smoke 2 joints of marijuana a day, 100 of them will have COPD in 10 years, right? So because the fellow on the block who's smoking marijuana, and I'm telling him, listen, stop smoking that marijuana. It's going to affect your lungs. He's going to tell me, move from there. Because nothing wrong with me, nothing wrong with the people around me, right? But if I had the data, if I could say to him, look, over the past whatever, so many people have been affected in this way, I think it would make a huge difference. But there has to be a psychologist involved, because how do you actually make someone behave differently, act differently? To me, this is a vexing question.
Yes.
Yeah,
yes.
because
I think Dr.
sometimes
Suraj was saying the same thing earlier.
Yeah, because sometimes information alone will not change. I have always believed that faith rides over facts.
Yes.
If you have faith, and faith is about believing. If you believe in something, no matter what evidence you see, unless you are a very open-minded person, no matter what evidence you see, you still hold on to your information. And that is so that the person who gives you the first set of information on virgin grounds are the best person, best time to be able to put proper, clear, authentic information in you. If you wait until somebody else has muddied the water and put false information in you, you have a problem in erasing that and put new information.
But it's true, Dr. Suraj and Dr. Greenwich. You look at the politics, for example. You have highly intelligent individuals who are potential MPs and ministers and so on. What do you hear them talking about? Bolums.
Yeah.
I mean, these are highly intelligent people.
Yes.
And if they're still talking about those things, it's like, as you said there, whatever was put into that mind, that brain at an early age is hard to change.
It's very hard. It's very hard.
So you have to evoke things like, as Dr. Greenwich was saying, a psychologist to come and assist you, because psychologists deals with human behavior. They understand the mind, they understand behavior, they understand what will make somebody think one way and act another way. And so I think we are underutilizing the psychology, because you can have psychologists assist you in behavioral modification, and even in those who've studied industrial psychology. When you see your performance is poor at the industrial arena, they can assist, because it may be that the people they are frustrated, or they don't like the job, or they don't see any upward mobility. There are many reasons why somebody of sound mind is not performing, and sometimes you need industrial psychologists to be able to work with them and make them understand and produce. So psychology is extremely important from that perspective, and behavioral psychologists, I think we should be making more use of them to enable us to get out of some of these old habits that we have. Yeah, and as I was saying, and I think
but Dr. Suraj, I mean, I know you're not a psychologist, but you're a philosopher, without a doubt. And no doubt, I mean, you have noticed behavior, especially in your patients for so many years. Surely you could opine and offer some kind of reason or reasons why it is so difficult to even get your patients to change behavior. Just earlier this evening we were talking, and we were talking about medication vis-a-vis prayer.
That's right.
Remember we had this discussion a short while ago. Okay? How do you get some people to understand that in some cases you need the medication, and not
Yeah.
prayer.
Yeah.
But there's this word which I don't like, but it is very accurate. Ignorance,
Mhm.
right? Ignorance. But you can't tell somebody they're ignorant. Because if you tell somebody they're ignorant, you end the conversation.
Yes.
They're already upset and so forth. But I think that at different levels, we are in fact ignorant. And
Mm-hmm. Yes, we are.
the more of us, I am ignorant. I know for that for sure. I am ignorant in many areas.
But we all are. In fact,
So-
just a while ago, Dr. Greenwich, Dr. Suraj mentioned a word in Creole to describe emphysema.
Right.
That's the first time I ever heard it.
Yeah.
So I was ignorant of
Yeah,
that.
you are ignorant.
Yeah.
But if I say to you, Andre, but you are ignorant, the first thing you're going to do is get upset with me.
Yeah.
But imagine if you said, you know, Charlie, you're right. I am ignorant. And because I know I'm ignorant, I'm going to open my eyes and my ears
Mhm.
and educate myself. And I think that this is an issue that we have. We are ignorant, we don't know we're ignorant, and we are belligerent in our ignorance.
Mm-hmm.
I remember on the wood of ignorance. For one thing, I remember once when I was in university in Barbados, the professor said one thing he noticed about St. Lucians is that he said they don't mind being ignorant, but they don't want anybody to know they're ignorant, so they don't ask any questions.
Mm-hmm.
Right. So, I mean, I had this encounter the other day. I had a lady who had advanced breast cancer. The diagnosis was made.
Mhm.
She had a very abnormal looking breast. I mean, it was huge, and I mean, it was clearly abnormal.
Yeah.
Clearly abnormal. Somebody had, before me, had done a biopsy. The biopsy came back and said it was cancerous, right? She ended up in my office for another reason related to the breast. And I said, but do you know that you have cancer? And she and her partner said yes. And I said, but what are you doing about it? And they said they were taking certain herbs and so forth. And in my mind, I'm saying, but this is crazy.
They're
This is
absolutely
crazy. I mean, in my mind,
Hmm.
I was screaming as a medical professional who has seen breast cancer over the years.
and see the devastating effect of it.
I was screaming. So I said, but is the treatment working? Because, I mean, we're not televised as such, but this lady's breast was like the size of a football,
Mhm.
right? And I mean, like 4 times the size of the, and clearly an abnormal shape. And I'm thinking to myself, but when this, it would have started like the other breast.
Yeah.
And it didn't get to this stage overnight. It got to this stage over a couple years. And I'm thinking, but would you not have said to yourself, month after month, you're doing this particular treatment, that it is not working? But she and her partner believed it was working.
Mhm.
And I realized that I could not make her understand what I believed,
Mhm. Yeah.
which was
Mhm.
that she was doing the complete wrong thing. And I was thinking, but this is interesting. She believes I'm wrong, and I believe she's wrong. You know? And it just said to me, you know, who am I to say to her that what she's doing is wrong? And she must be saying to herself, who am I to say to her? And I thought, the only thing here is evidence.
Mhm.
And if the two of us went to court and there was a wise judge sitting and the judge listened to both of us, I would hope that the judge would find for me and say, but Dr. Greenwich has presented evidence gathered from thousands of years of
Yes.
research to
Mhm.
show that the treatment of breast cancer is chemotherapy, surgery, hormonal therapy, and not taking some bush or whatever.
Mm-hmm.
But I just saying, how many people are prepared to do that? How many people are prepared to say, I might be doing the wrong thing? Have I entertained that I might be doing the wrong thing?
But I think it's a matter of whether you have a closed mind or an open mind. Whether your mind is willing to entertain other thoughts apart from those you have held tight to. And those people who hold on to their thoughts, who don't want to expand it, don't want to have a second view of it. And as so, therefore, they will always have their thought and they will defend it without listening to another thought. Another person, another mind will say, look, let me see what he's saying, if it makes sense. And you begin to logically try to understand. And this person may be able to be convinced.
Mm-hmm.
But I think generally you need to develop an analytical mind. What we lack here is analytical minds. We either believe or we don't believe. When you believe it, everything is right about it. You believe your leader, everything he does is right. You believe in your bus driver, he can kill somebody on the road. Well, the person was wrong. And yeah, so when you believe, it's either you believe or you don't. But you have not developed your mind where you can say, but wait, let me understand the two sides of that story and see. And then you make up your mind. Most people are not analytical, they just believe. So when they believe, everything is right. Now tomorrow, when this bus driver or the politician that you are following decide, well, you don't like him anymore, everything he does is wrong.
Yeah.
So either we like or we switch,
Mhm.
like or dislike.
Mm-hmm.
But the pain of thinking and the pain of analyzing, that is finishing. And
So have we relegated that to Facebook and
Google.
Google?
I don't know. I just feel that thinking takes more energy than just following.
It certainly does.
Yeah, and I think from early o'clock in the development, you remember we always talk about development of the child. You must teach the child how to reason things.
Mm-hmm.
And with reasoning will come thinking. And thinking will come logics. And logics will come a format by which you arrive at a decision. And so we do not encourage that enough in the children growing up. If they have a particular view, ask them, well, why you had to beat the cat? Oh, because the cat scratched me. But so you need to engage them in the thought process and begin to assist them to think logically.
Yeah. Yeah.
And
But I mean, I guess you can. Well, I don't know if the word blame might be a strong word, but I guess you can blame the sort of didactic teaching that we would have had.
mhm.
I'm pretty sure that is disappearing fast.
Yeah.
I mean, when we went to primary school, there was no discussion, there was no research. It was, you were taught the
Yeah.
3 R's,
That's right.
and that was it, right?
Mhm.
Even in medical school, Even in medical school, they've changed the way that they teach. They used to teach didactically, say, well, okay, this is the information which you need to know.
Tin can bed midi.
Right?
Do you know what tin can bed?
Yeah, I do. And now they're talking about problem-based learning. So it sounds a bit crazy to me as a sort of didactic student, where instead of teaching a medical student anatomy or physiology, you give them a problem. You tell them a man has a headache. What's the diagnosis? And you just let them run with it. And it's their job now to go looking at the anatomy, to go looking at the physiology, the pathology. So they now have the responsibility of researching the different areas to find out what the possible causes of a headache would be. And in a way you can understand why that is a better system, because you know it's like you're teaching the guy how to fish. You're not giving him 10 fish, you're teaching him how to fish. And it might be more difficult, he might struggle, but when you turn around and don't give him fish, he will go and fish and feed himself. So without a doubt, that has changed, and that's a good thing. Now we hear about SBAs and so on, where the kids have to work together, and that's the other thing we never did.
That's right, yeah.
You know, education was a very personal thing. You know, now groups are involved, and you have all the interpersonal. I mean, you know, this one lazy, this one not doing anything, and the other one having to do everybody's work, and you know. So I think that we are setting up an educational system which is more interactive and probably more meaningful for our population. But maybe this needs to be applied to public education as well, you know?
Yeah.
Rather than just, you know, billboards of don't do this or do that. Maybe we need to really get down to the basis, you know, like, why shouldn't I eat sugar and flour and rice? You know, maybe we need to tell people, well, look, you know, this is what happens when you eat sugar, flour and rice, and this is what happens when you eat dasheen.
That's right.
You know. So
but here's the scary thing. Even after you tell people, here's what happens if you do this and that and the other, like, look at the whole thing about smoking.
Yes.
If you do it, and there's clear evidence, not just from studies, but from, you know, observation, you can see the results of years of smoking and so on. We see it. We know it.
But Andre, one thing you have to say, and again, you wouldn't see it in St. Lucia, but you would see it in Scotland. That campaign has worked. When I went to Scotland to study in 1991. Now this is serious, I'm not joking, I am really serious. On the hospital ward, there was a room called the smoking room. In a hospital, on the ward, there was a room where you could go and smoke, right? Okay, so that's the first thing. I'm looking for Mr. Smith. The nurse tells me, I think Mr. Smith is in the smoking room. Okay? I open the door to the smoking room. I cannot see anybody. The light is on.
The smoke is so thick.
It's a normally lit
that's what
room. The smoke, and I'm serious, the smoke was so thick I could not see anyone.
What?
Mr. Smith! Oh!
Present.
He called from the corner. Okay? So you went from that. So I went back for a stint in 2012. No smoking on any hospital compound. Period. No smoking.
So the policy changed.
The policy changed.
Because I was going to ask you, how could that be?
Yeah.
I mean,
So the public got their head around this issue, and everything changed. When you go to a pub, going to the pub is a very popular thing in the UK, right? You get together, you socialize, you go to the pub. You go, you have a few drinks, you crack jokes, you know, very similar to what we do underneath the tree, right? Again, when you leave the pub, trust me, if you're accustomed wearing a pair of trousers for a few days, forget that. You have to put them in the wash because they reek of cigarette smoke just by going into the pub for a few hours, right? Now, if you go into the pub, no smoking. So you have seen a complete turnaround.
So what caused that?
Policy.
The turnaround.
Driven by policy.
Policy, I think the message finally got home that we don't want to smoke anymore. Right?
And the
We don't want
rules
to
make
smoke
it
anymore.
more prohibitive.
Yeah.
You can't smoke inside. You cannot smoke outside. You cannot smoke in the bus. You
Yeah.
cannot smoke in the plane. You can't smoke.
Right.
So many.
So those patients who were smokers, how did they survive? Because for some, they can't do without it.
The assumption is that they disappeared. They disappeared because that has finished. That has finished, and that was. I mean, for me, I was like, wow, this is impressive. This is really impressive.
Because the addiction can be very bad, I had we're in Scotland. I had a fellow, we had done a tracheostomy on him. Because he had a cancer of the voice cord because of smoking. So we removed the voice cord, and so he had a hole. He is breathing through the hole. One day I catch a man smoking through the hole.
Yeah, smoking through the tracheostomy. That's a common thing.
Yeah.
Why? Why?
It's not for lack of knowledge.
It is the addiction is too strong.
Too strong.
It's very, very strong, and it forced them to do it. Sometimes they may do it unwillingly, but because the side effects of not taking it.
But has anybody, Dr. Suraj, in your circle, explained to you why the addiction can be so powerful? Anybody?
Well, it is the nicotine and the other agents. The withdrawal from it creates a lot of physiological type of problems. You feel unwell, you feel all kind of ways because when you smoke, the components of the smoke interferes with your nervous system. It becomes part of the functioning of your nervous system. So it has been incorporated as part of, he's a body now, he's part of the, now when you cut him off, all of a sudden the rest of the nervous system is saying, where is he, we cannot function.
I see.
So
That's a very serious thing. I mean, I'm sure you've watched movies about cold turkey, right?
Yeah.
I mean, it's not a mental thing. It's not like, oh, I really want a cigarette. I really want a cigarette. No, it's not mental. It is physical. It is physical. So your body
headache, nausea
is now accustomed to this drug, and without that drug, your body doesn't function normally.
So how do some people, because there are success stories, how do some people, how are they able to overcome?
The will not to do it. Now, they always tell you that to stop smoking, gradual taking less and less and less. Say you start with 10 a day, next week 9 a day, 8 a day. They say that does not work. Most people who have stopped smoking,
cold turkey,
one day decide, bam, I'm not smoking again.
Yeah.
And there's a cutoff point, and they don't have it, they don't need it, they don't stay around it, no, nothing.
Yeah.
Just give up.
Yeah. I mean, there are different strategies. But the biggest problem is not to break someone's habit. It is to keep them off the habit. So, for example, intravenous drug abusers or alcoholics, right? They go to rehab and they off the drug. You know, it's a planned program over several weeks, and they are no longer addicted to whatever it is, right? But where do they go? They go back to the same place that they came from. So the same environment that led them to using whatever it is there, right? And you know, I always remember this guy. He had a podcast and he was talking about this thing, and he's like, "Hold on, you're not the problem. I don't remember if it was husband or whatever. I think it was wife actually. Your wife is the problem. If you want to
divorce.
stop, if you want, yeah, no, seriously, if you want to get off alcohol, you have to leave your wife, right? And it was because the guy, the wife refused to enter any kind of abstinence program. As far as she was concerned, she didn't have a problem. That's it, right? And he had to make a decision that either he was going to remain in this relationship or he was going to leave it.
So she was like a trigger.
Yeah, and in his mind, he realized that this relationship for him was toxic, right? So he went to rehab, he came off the alcohol, and he took a new path.
And talking about rehab, I mean, I read the stories all the time. You have people who have whatever issue, they go to rehab, they come out after 6 months, a year, whatever, and then they what do you call relapse. So they have to go back to rehab.
But the relapse because
of the trigger.
I mean, imagine if you had 5-10 friends, and basically you all meet up after work, you have a few drinks and you know, eat whatever and smoke and whatever. And that's your social life. Where am I going to find Andre? Oh, Andre is down by the shop with his friends. That's your life.
These are your buddies.
So when they take you and they say, listen, this thing is harmful, and you say, yeah, boy, this thing is harmful, I have to get off it. I say, well, okay, I'm going to put you in rehab. You go to rehab and you're clean, you finish. But where do you go? You go back to the fellas and say, well, guys, I want you drinking soda water and I'm not smoking cigarettes.
But how long can you maintain that?
How long that going to last?
It's
Every
true.
now and then
So
you
you have to be able to decide, man, as hard as it is, I have to be able to say, fellas, y'all are harmful to me. I love you, every one of you. Anytime any of y'all have a problem, I will be there for you. But I don't want to see you again.
But that takes a very strong person.
Very strong.
To every 10 people who are faced with that, maybe one or two may
that's your
think that
entire
way.
social support system.
Right.
Because these fellas are not jokers. They're workers. They have income. They have support. If you get into trouble, they will be right there with you. They're your buddies.
Yeah. Because imagine, for example, say you're at rehab, and these are the guys coming to check on you.
Yes.
That's
Yes,
right.
these are the guys coming to check on you.
Yeah.
That's right.
And when you need help, these are the fellas who are coming to help you.
Yes.
They love you. They support you. But the relationship is toxic. And unless an individual can appreciate that. I mean, if you get the 5 fellas to stop smoking and drinking, well, you really win. Right?
Yes.
If you tell the fellas, look, the only way I can come back to you is if we all stop. And we do something else.
That's right.
You know, and I'm sure that happens too.
Yeah,
You know?
of course. But probably the exception rather than the
but
norm.
as you know, there are many people who will drink, smoke, whatever, do drugs, whatever, and they're very functional. You know, they perform well at work, they perform well in family life, and you know, they appear to be all right. But of course, you know, things eventually will crash.
The addiction is a serious topic within itself, and we spend a lot of human resource on people who have addiction, time out of work, illness, medication, rehabilitation and thing. And I think that you need psychological support. You alone become very difficult to do it, because generally men are more likely to congregate as a group on a regular basis to bounce off their ideas, bounce off their jokes, etc. It is sociologically, men tend to be like that. And as Dr. Greenwich was saying, that if one of the men is not in it, it is so tempting to gravitate back, even if in his mind he says, I'll just go there, I will not drink, I will not smoke. You can only do it for a short time, because the cohesiveness of being together as men is one of the things that we have that keep us in the social gathering. So it is a difficult problem, and that's why you need a lot of psychological support for those who want to stop and have difficulty stopping it.
And just to ask a final question before we end. Do we have that kind of support in St. Lucia for people who want to change, want to stop bad
when I was in
behaviors?
Vieux-Fort in 84, 85, we had run a few Alcoholic Anonymous centers, at least two of them, one at St. Jude's and one in the town. And a cancer screening program. It was Martin, Didier, myself, and
M-School.
the M-School, three of us. And but then we left and went to postgraduate training, and afterwards returned. But I know that somebody was telling me there is an Alcoholic Anonymous center here.
In St. Lucia?
Yeah, but I don't know where it is. I cannot tell you for sure.
I'm not aware.
Yeah, but the Alcoholic Anonymous saying is that if you drink and enjoy your drinking, that's your problem. If you drink and want to stop, that's our problem. So they're here to support you.
Yeah.
In there. So,
But it's not only alcohol.
It's
we have a myriad of issues that people need help with, right?
Yeah.
So I'm asking the question: is there that sort of support system or solution?
I don't know the level of psychological support or rehabilitation we have.
Because both of you are saying it is extremely difficult.
Yeah. So I think we would need to get Naomi Jean-Baptiste on the program
to tell us more.
To tell us more. I think, Andre, it's a point that we should address. People need to know
but remember
what is available.
Yeah.
We also have a turning point as part of OKU. There is a Millennium Complex.
Heights Medical Complex.
So they do have a psychological support.
But even they keep a very low profile. I mean, you hardly hear anything about Turning Point unless, like you mentioned it.
But you're right. I
keep a very low profile, and they should be really, really up in people's faces.
That's right.
Should be, because you should know that the service is available.
Exactly.
Yeah.
And again, when it comes to data, without extending the program too long, do we know for sure how many children smoke marijuana, smoke cigarettes, drink alcohol? Do we know? But I know because
I think we do know, because I know Mr. St. Catherine with the statistical department. I know that this chap has done some amazing work.
Okay.
And I think that kind of data probably is available.
All right.
Yeah. And if it isn't available, you can ask for it to be on the census.
Okay.
Because Dr. Amanda King, she wanted to know about rheumatological issues. And I know that she engaged Mr. St. Catherine when he was there. And they put questions on the census.
Okay.
So the census is a very powerful tool, which I haven't really reviewed recently, but that is a seriously powerful tool with data. Yeah, because it's not just like, population and birth rate and that. There's a lot of social information in that statistical
report. And you can
report.
engineer the programming, the questionnaire to reflect what you think are the ills of the society or the issues of society.
Of course, you run the issue of confidentiality. Are you really going to tell the census agent whether you smoke or don't smoke, or
But they wouldn't know because your name is not on there.
Your name is not on it, but you know how it is. It's a small society. is the person who is interviewing you, do they know you? Do they know somebody who knows you? So I always worry about the validity of the data in terms of people being. I mean, everybody would be happy to say that they got an A in physics, right? But are they going to be happy to say that they're using an illicit drug, for example? But
Okay, Dr. Suraj, we have to wrap up.
Okay. Thank you very much, Andre, for having me on this platform, and thank you very much, Dr. Greenwich, for being here at reasonably short notice. So I'm happy we had a very lively discussion, etc. And the listeners, next week, same time, I'll be with you. So just listen on. Thank you very much.
Thank you very
and
much.
Have a good evening.
Thank you, Dr. Greenwich, and thank you, Dr. Suraj, for your service.
Thank you, sir.
Right. This has been Doctor in the House on Rev-Up St. Lucia every Tuesday from 6 p.m. to 7 p.m. So listen again next week Tuesday for another Doctor in the House with Dr. Leonard Suraj, brought to you with the compliments of Laplace Salazar, Ultramat, the Library, Cooperative Credit Union, and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient's safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
Laplace Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laplace Salazar, of course. Laplace Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us at 97.1 FM and online at revupslu.com. Call the studio at 572-9710 or WhatsApp 287-0971. Or Rev-Up office numbers are 572-0383 and 572